Sounds great. Thanks, Damien. Welcome, everybody. It is the third cohort of the Applied Practice Experiences. And my name is Lee Taggart. I'm the academic advisor for these projects. And we have two students presenting today. And our first student is Mandie Fleming. And Mandie did her practicum with the Flathead City County Health Department. And her site mentor is Jim Wardensky, who's the environmental health manager there. And the name of Mandie's presentation is Enhancing Groundwater Management, Strategic Outreach and Education for Public Use of GIS, Groundwater Monitoring and Site Assessment. And Mandie, if you want to share your screen, that'd be great and start. And I just want to let everybody know, if you can hold your questions till both presenters are done, that would be great. Or you can put your questions in the chat. All right, Mandie, take it away.
Good afternoon, everyone. I'm Mandie Fleming. My name did change in my project since I sent it to you, but it's Strengthening Groundwater Monitoring Through Community Education and Performance Management. So I did my project at the Flathead City County Health Department in Kalispell, Montana, within the Environmental Health Division. My site mentor was Jim Wardensky. He is the Environmental Health Manager, and I also had a lot of support from Gracelyn Abel, who works within environmental health. So when I first met with Jim to discuss groundwater monitoring, no, let me take a step back. I'll give you some insight to groundwater monitoring at the Flathead City County Health Department. So the Flathead City County Health Department implements groundwater monitoring to determine if a septic system can be approved and installed while ensuring that we're protecting water quality. So homeowners must submit a site plan and monitoring form by March 15th for approval. And then they are in charge of installing their own observation wells, collecting data weekly, and then submitting results by August 1st. So there's a small window of monitoring, and we're trying to capture peak groundwater levels 2 weeks before and 2 weeks after the rise and decline. And the Flathead City County Groundwater Monitoring Program is regulated by the DEQ and our local health board. So when I first met with Jim to discuss a project, our initial goal was to deploy GIS technology to improve groundwater monitoring by creating a centralized public-facing tool that allows individuals to directly enter weekly groundwater level data. Currently, some staff are using this tool within the GIS system to enter data, but our long-term goal is for landowners conducting the monitoring to enter the data themselves. This will enable environmental health staff to monitor the data in real time and take immediate action if needed. So if they saw data errors or something that didn't look right, they could contact the landowner and intervene in real time. However, after some discussion with staff, we realized that the community needed more foundational support in groundwater monitoring before we integrated a more complex GIS system. And so when we sat down, we identified challenges in landowners collecting and logging weekly groundwater level data. And this really shifted our focus to ensure that the landowners and stakeholders had the necessary tools to monitor effectively. So to address this, I created materials that provided stakeholders with the knowledge and tools they would need to better lay the groundwork for future GIS integration. I also wanted to ensure that once the GIS was fully developed, we did have materials to bring awareness to the program, as well as metrics to assess the program. So the first two products I created were around community education and resources. The first one is a 10-minute video on how to groundwater monitor. And I went out with Gracelyn, one of the staff for environmental health. We went to a site, we found someone with an excavator, we dug an 8-foot hole, we had the groundwater monitoring pipe, we installed it. So we really did this step by step. And not only did this help us create a video, but it really gave me hands-on experience to understand what goes into groundwater monitoring and a better idea of what environmental health staff are doing. And so, though I don't have time to show you the 10-minute video, I did clip less than 30 seconds so you guys can see what the video involved. So I'm going to play that for you.
Let's get into the installation process. Start by digging a hole 8 feet deep using your excavator. Then insert the PVC pipe into the hole, making sure the slots are correctly positioned to allow water flow while keeping the soil out. Wrap the fabric around the slotted area to prevent debris from clogging the pipe. Then place the cap on top of the pipe to keep out contaminants. Flag the pipe and clearly label it. Ensure that the pipe extends 24 inches above the natural grade and check that the ground around it slopes away to prevent surface runoff from affecting your readings. Proper installation is very important to collecting accurate data, so take your time with this step.
So that was a small clip. The video really starts with the application process, choosing a site, how to install, how to measure, and how to log your data. So this, I talked to Jim today. This is posted on our website. So anyone needing more resources can go to our website right now and watch this video for folks who maybe learn better watching than reading step-by-step instructions. So the next, in case someone does better reading step-by-step instructions, I created a groundwater monitoring resource packet. So community members will use this resource packet as a guide to learn more about groundwater monitoring. It also provides step-by-step instructions. It includes policies around groundwater monitoring and links to the application. Here's another look of what's inside the packet, from installation recommendations, measuring procedures, and then all these resource links are live links that you can click to get to the application or the how-to video that I just posted. My other product was a groundwater monitoring flyer. So to continue supporting the environmental health department with the GIS component of the project, I created a GIS groundwater monitoring flyer. So this will be distributed once the program is launched to inform folks of the groundwater monitoring GIS program, as well as explaining how it can enhance the groundwater monitoring process. This will also be available online and within that resource packet that I just showed you. So next, once environmental health does deploy the public-facing GIS program, I created key performance indicators, or KPIs, to measure the success of the program. So I utilized performance management. I started by defining program goals, conducting a program review of the processes that we're going to implement, identifying program and performance standards, creating more goals, and then developing measurable and trackable metrics. So I established 3 specific metrics that will allow the GIS program to be evaluated by environmental health staff to make sure that it is delivering its intended benefits. So those metrics are going to be a 50% usage rate of the GIS platform among individuals who are conducting groundwater monitoring within the first year. We also are going to have a 75% of users who correctly identify at the peak groundwater level, and then 90% of biweekly data reviews will be completed by environmental health staff and documented. If they're seeing any data errors, they'll document those and then follow up with the actions they needed to resolve any data issues. So within this project, as far as public health foundational competencies, the first thing I really focused on was clear communication. I wanted to make sure I was tailoring information for a diverse audience, ensuring that it was understandable and easy to apply, whether you're a landowner or a seasoned professional. I also wanted to explore different ways to communicate effectively using both the printed material as well as the video material. I also wanted to establish a way to evaluate the program. So leaning more on evaluation and applying frameworks from program management. I developed those KPIs and aligned public service principles with data-driven decisions. Also, by reviewing the program's design, I looked to identify challenges that might arise. And then I wanted to make sure I established clear metrics for ongoing program management once the GIS was deployed. So to wrap this up, really this project gave me a deeper understanding of what goes into implementing public health programs. I think a key takeaway for me was the importance of addressing foundational issues first, like proper groundwater monitoring practices, before advancing to more complex components like GIS. As much as I wanted to work on the GIS component, I don't think it would have been possible without laying some of that groundwork and ensuring that our community knows how to properly groundwater monitor and log the data. I also have to say that this gave me a greater appreciation for environmental health. I have a better understanding of the complexity that goes into environmental health and also the significant amount of public interaction that's involved. I think when you think about environmental health, you envision them at restaurants or out in a field with no people around, but there is a ton of public facing work that goes into EH. I've worked here for over 14 years, and I have to say this project really expanded my public health knowledge, and I feel like I can be a better public health steward for environmental health issues after doing this project. So thank you guys for joining me, and I will be available after for questions.
Thanks, Mandie. Great job. Yes, a perfect example of sometimes the practicums start out one way and then sometimes they have to morph a little bit, and that's just perfectly fine. And good job for just recognizing all that along the way. So super job. And thanks again, Jim. Jim has been a site mentor for us in the past, so we're always greatly appreciative to folks like Jim. So, okay, so our next speaker is going to be Molly Brazier. Are you okay if we call you Molly? Molly? That's how we've been going. And we're hoping that Molly's audio is working. We were having some issues, so go ahead and just say a few words, Molly. Let's make sure your audio is working. And I don't think we can hear you yet, so let me see if I can't. It looked like your phone was muted. Can you unmute your phone?
Can you hear me now?
Ah, yay.
Hi, can you hear me now? Yay. Yep. Okay. All right. Save the day at the last minute. Thank you so much, Lee. You'll have to excuse me. I've never had a problem with Zoom on my laptop before. And of course, the day I log in for my big presentation, the audio on my laptop died. So I hope the speaker on my phone is sufficient for you all to hear me okay?
Yeah, we can hear you just fine, Molly. So
okay. Let me see if I can share my screen on my laptop here. And
while you're doing that, I'll introduce your two site mentors. And Amy, I apologize. I'm probably going to get your name misspelled. Amy Sazilo. And Amy is with, she's one of our PhD candidates, but she also has been working with Javaya, which is the organization that Molly did her practicum with. And also Laura Spiro, who is the founder of Javaya, was also a consultant on this project. And the name of Molly's presentation is Javaya Monitoring, Evaluation, and Project Planning Support. So we can't see your slides yet. At least I can't.
Lee, I wonder if you might have to share my slides with the limitation I'm having on my phone. It looks like it won't let me share the slides either. Sorry about that.
Can people see these slides? Does that work? Maybe give us a thumbs up.
I can see them fine.
Okay, I'm seeing lots of thumbs up. Okay, so Molly, take it away and just let me know when you want me to advance the slides.
Okay, yeah, will do. Thank you for bearing with me. Thank you guys for your time today. My name is Molly Brazier, and I am a master's in public health and public administration grad student. One more course to go after these presentations. And I've worked as a registered nurse for 11 years, and then also have a degree in cultural anthropology from a long time ago. My APE was about Javaya Oral Health, which is a non-governmental organization that works in Nepal to expand oral health practices throughout the country. And you can go ahead and advance the slide, Lee. So my site mentors, I had 2 site mentors for this project. Amy Scalio was the first one. She is a PhD student in public health at the University of Montana and has worked extensively with Javaya. And then my second site mentor, to avoid any conflict of interest with Amy also being a student, is Laura Spiro, and she's the founder of Javaya. She started the organization in 2007 and has lived and worked extensively in Nepal, speaks Nepali, and has a master's in social work. So it's been really great to work with both of them. The background photo I chose here, I took while I was in Nepal, which I had the privilege of going to last month. And I think it just gives a little bit of context to how rural most of the country is and how difficult it is to access most communities there. And you can go ahead and advance the slide, Lee. So the first deliverable I came up with for my project was a 2023 data and monitoring evaluation report. I was able to get my hands on the data that Javaya collected from all that they accomplished in 2023. They successfully worked with 70,000 people throughout Nepal during the time that they've been established. And they work with the basic package of oral health care, which was established by the World Health Organization in the early 2000s. There's several components to this package, which is designed for low and middle income countries to help expand access to dental care in places where dentists don't traditionally work. The first component is oral urgent treatment, which includes extractions of bad teeth. They also have a focus on affordable fluoride toothpaste and then atraumatic restorative therapy. Javaya calls their specific program BiPAC Plus because they also focus on the application of silver diamide fluorides, sealants, and varnishes. They rely on training lesser skilled providers in order to perform these interventions. And what's nice about these interventions is that they can be performed without running water or electricity in these traditionally hard to reach communities. So my first deliverable, I took the data from all that they had accomplished in 2023, and I put it into a new spreadsheet, which was focused on the REAIM goals. REAIM is a public health tool that helps programs monitor and measure their effectiveness, and it stands for reach, effectiveness, adoption, implementation, and maintenance. And we looked at what we were tracking in 2023 and then what we hoped to track in the future. And from this, I was able to transfer all the data and then make a project report that helped to summarize what Javaya is currently not tracking that they hope to track in the future. Javaya currently works in 13 different municipalities in Nepal, and in 2023, they treated over 11,554 patients. They do their work in several different clinics, as well as seminars and outreach events and School Smiles programs. One of the more important or interesting things that I was able to measure was a prevention to treatment ratio. And this is the number of patients that are receiving curative treatment divided by the number of patients that are receiving surgical treatment. And they're hoping that by tracking this metric, they can see an improvement in overall population health for oral health in Nepal. Another accomplishment for Javaya is that currently all providers are up to date on their certifications. Javaya makes sure that their providers have the competencies in order to perform these interventions, and they have rigorous standards that everyone must adhere to. And currently all their providers are 100% compliant with that. And you can go ahead and switch to the next slide, Lee. The next deliverable I came up with was a survey toolkit. I wasn't actually able to conduct surveys in Nepal because of the limitations of the project, but I wanted to create something for Javaya that would help them to understand the barriers and obstacles and things that they have going for them as they expand the program throughout Nepal. So I based the survey toolkit on the social ecological model, which looks at different layers of health from the individual level to the systems level. And each of the surveys are based on methodology that I took from other surveys that have been successful. The first one was the individual level, which is oral health practices and barriers. I wanted to be able to understand better what barriers exist for people to be able to take care of their teeth well. I also looked at barriers for providers, what limits they see in their communities that prevent them from being able to give good care. And then I added in barriers and available equipment. I looked over the original basic package of oral health care from the World Health Organization, and from this was able to make a list of what equipment is necessary to perform these interventions. And the hope of this survey is that with that, as Javaya expands to new communities, they'll be able to have a checklist tool that shows them what's missing so that they can set up and establish themselves well. And then the final level I looked at was systems and key stakeholder barriers. Javaya is hoping to make a partnership with Jukau Hospital, which is a not-for-profit research hospital based in Nepal. And this survey was aimed at the kind of higher level people within that organization to see what financial barriers or logistical barriers would need to be overcome so that they can expand their programming. And you can switch to the next slide, Lee. So these are the public health competencies that I was able to demonstrate through this project, selecting methods to evaluate public health programs. I think I did this with looking at the REAIM metrics for the program that they currently have established. Interpret the results of data analysis. I was able to do this by looking at the 2023 data and coming up with what practices they currently have in place and what they can do to improve. Assess population needs, assets, and capacities. I think I accomplished this with my survey toolkit, which looks at what's available and what's not available in these different regions of Nepal. And then these last two are focused on advancing cultural awareness and policy analysis techniques in these different areas. And I think I was able to do this by going to Nepal and seeing boots on the ground, the context that they're working in, and especially how difficult it is to work in these areas because there's a very limited amount of infrastructure in Nepal, which makes moving around challenging and getting equipment to these different areas really challenging. Currently, to get from Kathmandu, which is the capital of Nepal, to the Sulukhumbu, which is a region that I know well and have worked in for a while, it takes 16 hours by a Jeep ride. And that's the most streamlined way for people to get proper health care in Nepal. You can switch to the next slide. So building on this, when I was in Nepal, like I said, most of the work that I did, in fact, all the work that I did with Javaya was done remotely to give these deliverables. But being in the country really helped to contextualize for me the importance of the work that they're doing. In the lower Sulukhumbu, no one has indoor plumbing and there's very limited electricity. So people brush their teeth outside. Unfortunately, I didn't see any fluoride toothpaste in any of these photos that I took. These were just taken outside the homes of two hosts that I stayed with while I was there. And it looks like these toothbrushes are probably shared among the whole family because these are the only toothbrushes I found for families of about 7 people all living in the same home. So it really highlighted for me the importance of the educational work that Javaya is doing, as well as these basic interventions to help people have better dental care. While I was there, I saw a lot of people with dental complaints and teeth that are rotting in their mouths, and it just showed me how important this work is that they're accomplishing. And you can switch to the next slide. So this wasn't formally part of my APE, but the major reason that I went to Nepal was to help with this clinic in the lower Sulukhumbu. This is a project that I've been involved in for about 7 years now. In 2020, we were able to fundraise the money to rebuild the actual clinic. And that was the last time I was really involved in it because the village that I was working with was applying for government health status to make it a government-run clinic. And they were finally able to accomplish that last year. So now it's a government clinic with a salaried government doctor who's there 24/7. But even with that, the entire operating budget is $100 US a year. So when I was there, I was able to take a look at the equipment they have available, which is extremely limited. And then on the way back, I was able to get a lot more equipment for them in Kathmandu, using my background as a nurse and a little bit of a background in public health to figure out what would be best for the clinic. So the photo on the left is the neighbor of the villager that I stayed with. I just think she looks really pretty there with her cows. And then the photo on the right is the villagers that I stayed with. One of them is the leader of the village, and the other is my friend Angshu. They're both on the board of directors for the clinic. The taller American guy in the middle is a physician that I was there with, and we were both hearing patient complaints and trying to brainstorm ways that we can support the clinic so that it's more successful. But this is a project that I'm really proud of. We did see a lot of dental complaints in the clinic, and one of the frustrating things is that I am not BIPOC trained and didn't have any way to help these people get interventions for their teeth complaints, which there were quite a lot of, but we were able to refer them to a clinic in Kathmandu. But of course, it's a 2-day Jeep ride for people to get there, but several people did go to Kathmandu in order to get dental health care. But again, it really just showed me how important the work that Javaya is doing is for these hard to reach communities. And I hope they'll be able to be successful in expanding further. And I hope that the things that I contributed to their project will help them to accomplish that. And you can go to the next slide. And that's about it. So thank you. And I'm happy to take any questions.
Awesome. Thanks, Molly. I'm going to stop sharing screen and just put it out there. Does anybody have questions for either Molly or Mandie? You can put them in the chat as well, or you can unmute yourself.
Hey, Molly, nice work diving into this project. It's a really complicated program, and so you did a great job of grasping all of it, and it's so nice to hear somebody else talking about it. I guess my question for you, I'm not going to try to stump you or anything, and you've already shared some of this with me and in those last few slides, but from your background in nursing, you dove into oral health. What was the most surprising find, whether that be something in Nepal or kind of just, again, your background in nursing?
You know, my background in nursing is so completely different from oral health. It's amazing and kind of humbling how much we divide people's mouths from their bodies. So for me, there was a huge learning curve to understand these interventions. And I think I've really only hit the tip of the iceberg with understanding them. You know, when I was working in the clinic, I felt competent to help out as a nurse, but looking in people's mouths, which was probably every third person had complaints about their mouths, I felt totally lost and useless. You know, I can see that there's bad cavities and that they need help, but beyond giving out Tylenol, I really didn't know how to help them. So I'm humbled to think of the work that Javaya does, and you know how intimidating and complicated it is to successfully set up these clinics and have competent providers to perform these cares in these areas.
Thanks. Well, great work again. Congrats.
Yeah, thank you so much, Amy. I really want to give kudos to Amy. She's been incredibly supportive and patient with me through this whole process and really held my hand so that I was able to deliver something competently to Javaya. So thank you for taking all the time to work with me, Amy. I really, truly appreciate it.
Nice. Thank you. Thanks, Amy. Yeah. Any other questions for Molly or Mandie?
Lee, this is Claire. I have a quick question. Nice work, both of you, on your presentations. Mandie, I have a question for you. I really liked your video, and I was just wondering if you had experience making an educational video before, and if there were any challenges that you encountered.
So I can't take much credit for the video editing. Gracelyn, who I talked about earlier, who's part of environmental health, she, I think, is an award-winning videographer and has created documentaries before. So while I went out and shot the video and voiced it over, she did all the editing. So I can't take much credit for that part. But I think just logistically trying to go out there and know what frames we had to shoot and make sure we got all the information on the video was really tough. When she made the video, we had to add a few scenes. And and kind of pre-write it out. So when you watch the whole video, it's not just us out there. We had to add a couple of things in there because you forget pieces when you're actually in the thick of things trying to install groundwater monitoring pipes. So that was probably the most difficult, is missing some of the information and trying to pivot.
Mm,
Great, thank you.
You're welcome.
There for the question.
And
Any
Lee,
other
can
questions?
can I hop in with a question?
Absolutely.
And this is actually for both Molly and Mandie. I really enjoyed the presentations. It was great. And both of you in different settings, including different continents, worked with rural communities and populations. And so did you are there things that you maybe did differently because you were working with a rural population than if you were working in a more urban setting for both of your projects? Just curious.
Mm,
I'll go ahead and jump in. I'll be totally transparent. The work that I did was all done from my laptop in my very, very non-rural, comfortable, near Seattle-based home. But going to Nepal, it's quite rural. Like I said, it's a 16-hour Jeep ride to get to that village, and there's really no healthcare infrastructure in this place, in the Sulukhumbu, where I was specifically. So like I said, any kind of dental interventions that we wanted to help people get were super far away from where they're physically located. So, you know, to me, that was the major barrier, was just the lack of infrastructure in the country. And I'm sure it's the major barrier that Javaya struggles with in the work that they do, is, you know, setting up in these places where the roads are really bad. The main road to get to the Sulukhumbu has been washed out by some major landslides, and at times you're literally just driving through the riverbed in order to get up to this community. As the crow flies, it's 75 miles away from Kathmandu, but with the mountainous terrain and the landslides, somehow that turns into a 16-hour backroad adventure to get up there. So, you know, thinking about establishing a proper functioning clinic, the supply chain issues that come with that are quite humbling.
mm. Thanks, Molly.
For me, it was really thinking about how we deploy the information, and that's why I wanted to create a video and a readable guide, because if you don't have Wi-Fi in a rural area, you're not going to be able to access that video. So trying to provide education in different ways, like the packet that we could mail out to someone if needed. I also think a challenge down the line when trying to sell the GIS platform to folks, they might feel intimidated using that online platform and using new technology. So I think as we move forward with that, trying to think of ways to communicate the benefits in a way that's going to help them understand why that public facing GIS system is going to help them, even though it feels like one extra step, is going to be important when we're speaking to different people in rural areas.
Great, thanks, Mandie. It looks like Dr. McKay has a question. Go ahead, Kimber.
Thanks, Lee. This is a question for Molly. Molly, hi. Great presentation, both of
Hi,
you.
Kimber.
Wonderful to hear from you, Molly, upon your return. And, you know, work on oral health care, as you mentioned and observed, has long been sort of the, you know, distant relative of the meat and potatoes of global health work. And I was wondering, based on your experiences there and the new perspectives and focus that you had, because you were working with an oral health oriented INGO, like what was your sort of feeling or assessment of the extent to which the Nepali practitioners that you were interacting with were understanding the importance of oral health at this point in time? Or does it still feel like it's coming in, you know, a distant second to the main, or solutions that people are trying to the main challenges facing people?
I can't exactly speak to my interactions with providers, because I didn't talk with many oral health providers, in fact, none, when I was in Nepal. But I will say the general sentiment among the villagers is that oral health care isn't a priority. I didn't see a lot of toothbrushes, and when I went to Kathmandu to buy supplies, I was really gung-ho on getting a lot of fluoride toothpaste and floss and toothbrushes for people, and the villager that I was doing the shopping with didn't really find that to be a major priority. I had to be a little bit pushy in order to include those things in what we were sending back up to the village. So I don't know that it's that large of a priority for people in Nepal, possibly until their mouths are in a lot of pain, which unfortunately there were quite a few people that had a lot of mouth pain that I saw when I was up there.
Yeah. Very interesting. I think one thing to note is, like, certainly in Western Nepal, in the place where my work has been and where Chelsea Kuiper also just returned from to do her preliminary sort of pilot work up in Homla district, is because the incidence of hepatitis B is so high that villages are actually actively discouraged from doing things like, you know, sharing toothbrushes and stuff like that. So then, you know, the sort of lore or mythology of, you know, toothbrushes and who has them and whether or not they'll share them and all kinds of things like that starts to grow in some unexpected or unanticipated ways. So it's been very interesting to see how thinking has around oral health has changed as a result of a big hepatitis B testing campaign that happened in those villages where we work. So that's so interesting, and thanks again for sharing your insights. And look forward to reading your ILE and learning a little bit more.
Yeah, thank you. I appreciate your time, and I look forward to you reading it. I've always been very interested in the work that you do in Nepal.
Great. Great conversations. Thanks, everyone. Any other questions, comments, thoughts? Been wonderful hearing from everybody, and thank you again to Jim and Amy and Laura, who will be watching this recording later, for the site mentors. We really appreciate it. And great job, you guys.
Thank you for your time.
All right. So I think we'll call it a wrap today. And thanks, Damien, again for facilitating, and have a great afternoon, everybody.
Yep. Thanks everyone for
Thank
being here.
you.
One.